I have a question for the panel for the doctors, and this is more for patients like myself that do kind of more of the treatment through self-monitoring because the doctors are not educated. And I know the risk factors for males are rare in this disease. And through the education this week, organ damage, renal damage happens with the medication we're on. So my question to you is, what type of laboratory tests is recommended to look at those key factors of what type of possible organ damage may happen, and what frequency would it be? 6 months, yearly, quarterly, and what type of tests should I request my doctors? Because they'll pull any test I ask them to pull. I just got to know, should I have a kidney function test done every 6 months, every year, quarterly? What is your recommendations?
Do you want to take this one, Paul?
Well, the first thing would be, have you had kidney involvement in the past, and do you have any additional risk factors for kidney disease, like hypertension or anything like that? And depending also of your profile of medication, if it's only anticoagulation, it doesn't have any direct negative effect on your kidneys.
I'm on the controversial rivaroxaban and aspirin.
Okay.
Because, I clotted on rivaroxaban, so I put aspirin on in addition. Right. I know it's recommended. I am triple positive.
Right.
I'll explore that later.
But I wouldn't be so worried about the drugs themselves. And so otherwise, I think I would manage you just like anyone with a triple positivity and check at least once, maybe twice a year for your kidney function, which would be a serum creatinine and urine analysis to make sure there's no protein or blood that develops. They're very simple tests, but they're quite efficient. I would monitor your pressure. That's something that I think everyone with APS should have optimal management of any cardiovascular disease. Risk factors for dyslipidemia, so cholesterol, hypertension, any diabetes should be very strictly monitored and treated if necessary. And sometimes even for cholesterol in ranges that are below what you would recommend for the general population. So you're considered high risk, a little bit like your diabetes patients, where we will try to get the lipids at a lower level than what's recommended for the general population.
So the only, other than normal, would be a kidney function test?
Yeah, and your blood counts, because you want to make sure you're not developing any of the platelet, being low, or your hemoglobin being low. They're usually the two cell lines you'll want to check. Anything you would add?
No, that's fine.
Thank you for that information.